Well, according to some estimates, the nation could face a shortage of at least 90,000 doctors in the next decade. That's according to the Association of American Medical Colleges. Among the reasons is our aging population and also doctors retiring in larger numbers. The association also says, though, that Obamacare, the new health care law, is making this worse. Our next guest, a frequent critic of Obamacare, says maybe this doctor shortage thing is a little overblown. Dr. Scott Gottlieb was a senior official at the Centers for Medicare and Medicaid Services during the Bush administration. He joins us now, and you had penned this op-ed piece with Ezekiel Emanuel, who is a strong supporter of the health care law, and you both had come together in this magical moment to say the doctor shortage is not the big issue of this law. Why do you think that?
Well, people who are making an assumption of a doctor shortage overall are making really assumptions based on today's resource use, how doctors practice medicine right now. We know medicine is going to become more productive in the future, and doctor efficiency and productivity will increase. So you have to allow for that. And so we also know that there's going to be a lot of non-physician providers providing services in the future. So you can't just make straight-line assumptions from today's resource use and project it out into the future and say, well, since there's going to be this many more old people in the future and this many more people insured, we're going to have a shortage. You have to allow for that dynamic effect.
But the association, again, the Association of American Medical Colleges says that they expect 32 million more people to enter into the insurance market.
Right.
And they are looking at year by year, again, their projections, by 2015, seeing a doctor shortage of nearly 63,000. So you're saying technology, having more nurse practitioners and nurses and other people that can help you besides doctors will make up the difference. But how can it make up the difference for an additional 10 of millions of people?
Well, remember, these people are getting medical care right now. They're just getting medical care inefficiently because they're not insured. Simply giving them an insurance card isn't going to necessarily mean that they become more efficient medical users of medical care. And in fact, we know when people enter onto better insurance schemes or insurance schemes, their treatment patterns don't change a lot oftentimes, unfortunately. So when people go from Medicaid to Medicare, for example, Medicare being a much better insurance benefit, a lot of times they still access medical care the same way they did when they were beneficiaries. So I think just assuming because we have 30 million more people who are uninsured, they weren't getting care before, now they're going to be getting care, that's going to create the shortage. That's a little bit of a naive assumption. They were getting care before, they were getting care inefficiently. Unfortunately, a lot of them will continue to get treatment that way.
When you talk to different doctors, they have different points of view on this, obviously.
Right, sure.
You have been a practicing physician in your time. A pediatric heart surgeon wrote in the Wall Street Journal something that was a little bit more anecdotal, talking about the feeling how it is to practice medicine. And he said something to this effect, saying that the compensation levels are falling to doctors with Medicare and Medicaid.
Right.
That's not a good thing. He was saying the new law did not stop lawsuits and malpractice premiums. And his thinking is that it's really creating a bifurcated market where you have the physicians, the limited amount that are going to accept Medicare and Medicaid, and the lines are going to be longer to see them because more people will be able to see them.
Right.
And then you're going to get these other doctors that are going to be concierge doctors, where if you're wealthy, you can afford to go to them and get great care. And if you're not, if you're middle class or lower class, you're not going to do that. How concerned are you about a bifurcated market?
Well, that's certainly true. There'll be multiple tiers, probably 4 tiers, and there will be shortages for certain patients. I mean, patients who have Medicaid, they're going to have a hard time getting access to physicians. And frankly, I believe patients who have Obamacare are going to have a hard time as well, because you're not going to see physicians taking those insurance schemes. So it's going to feel like there's a shortage to a lot of people because you're just not going to be able to get an appointment. But I don't think there'll be a shortage overall. There'll be enough physicians. They're just going to be servicing people who are in different insurance schemes at different markets.
Back to what Ezekiel Emanuel said this weekend, you can keep your doctor if you can pay for it. And if you can pay for these services, you're going to have no problems and get right in. But if you don't make, $1 million, you're not.
Right. Well, if you can pay for it completely. One thing to remember about Obamacare, the difference between the bronze plan and the platinum plan is often only the copay structure, meaning that you don't get a better network of physicians and you don't get a better drug formulary. So you can't buy up to a better benefit in Obamacare. You can just basically pay down your copays. So if you want to get your doctor and your doctor's not in your network, a lot of times you're going to have to pay out of pocket completely.
Really interesting side effect that we haven't heard a lot about. By the way, Ezekiel Emanuel is supposed to be on with you today.
Right.
Again, the kumbaya moment that did not happen. Unfortunately, weather kept him from coming on the program with Scott, who he co-authored this piece with. So maybe someday Scott will have that.
Then he would have disagreed with what someone.
He probably would have disagreed at the end, but that's what happens when you get stuck on a train in the snow. We welcome him back on the program anytime. But Scott, it's great to see you.
Thanks a lot.
Thank you very much.